Good evening. I'd like to call this Board of Trustees workshop to order.
Thank you, Mr. Meek. Good evening. We've titled this a school opening update because it both combines an update regarding the opening of school along with information related to COVID, which obviously impacts not only the opening, but the ongoing operation of school. And this will serve in lieu of traditionally the first board meeting of the year, the superintendent's report. It's kind of a report of the opening of school. So this will serve in lieu of that as well. All right, our enrollment. We're back at pre-COVID enrollment. We're at 76,219. We currently have 3,012 in the virtual program, and we accepted them into the virtual program into the past week. That's 3.95% of our total student population. Again, our pre-COVID level is slightly above this. We're at 76,999. Now, our first official numbers will be issued on the 15th day, which is September the 7th. We started school with 17 teacher vacancies, 13 regular ed, 4 special ed. They all are being covered by long-term subs, certified subs, or in some cases at the high school level, by currently employed certified teachers in the school being compensated additionally to teach during what would be their planning time and have their planning time after school. We are short 84 bus drivers. We have 90 in training. That's 62 regular and 22 floaters. And as you all will recall, the floaters simply mean that's a sub that shows up every day. But we are down that many. We're down 57 building services workers, and we're down 55 in fans. Now, the issue with bus drivers obviously impacts student arrival, dismissal, arrival home, that sort of thing. And the only way to address the driver shortage, barring getting additional drivers, is to double routes. Now, with building services, we can address that through overtime. Utilizing our current personnel, they'll get the cleaning and that sort of thing done at the school level by using overtime. Well, overtime helps with the bus situation, but it doesn't get them home any earlier. Food and nutrition services, Joe has a number of steps he can take there, a number of strategies, including the use of overtime, that doesn't affect meal service to students, at least to this point. Bus transportation, we have 25,539 riders, 62 regular route driver vacancies. However, the good news is our morning arrival, 97% of our routes are on time for school, compared to 83% in 1920. Now, we don't use a comparison with last year because last year we only had 70% of our students coming to school. So we're dropping back 2 years, and 2 years is also the last year before we adjusted the time schedule. The other, if there can be additional somewhat good news in this, really our drop-off times in the evening are not significantly later the first week of school than they were in 1920. They're a little bit later, but not significantly later in the afternoon. Now, obviously, that first day of school was, all first days of school are unusual and challenging as far as transportation. But when you have, I think, a total of 46 different tornado watches and warnings posted throughout the afternoon, it considerably impacted the arrival time home. But our folks did an excellent job, both out in the field on the buses, our transportation centers, and our schools at managing that in a way to maintain safety for our students and our employees. The other thing that I would note there, that part of the difference in that 15 minutes, particularly in the morning, is not just 15 minutes, but in some cases, and right now this is anecdotal, but we'll have some data on it later, the 15 minutes is gaining us 20, maybe 25, in some cases perhaps 30 minutes, because it changes the window of time the buses are on the road. And some of you might think about commutes or drives that you make. For example, I've got a very short commute if I'm coming straight in here to the office. But if I time that 10 minutes different in the mornings or 15 minutes, it can almost double the amount of time it takes me to get here because of the traffic pattern. So that was a huge improvement. COVID, that's what I think continues to be the topic of utmost interest. It is driving and directing much of what we're having to do, and it is occupying, as I'm sure you all know, a significant amount of time within the system. So today, students, this is today, has 245 students isolating. The closest comparable date in 2021 was the 14th of January. The peak date was the 7th of January with 470. We're at 910 quarantines. Closest comparable date was January the 26th. Peak date was January the 10th, 1,250. That means those cases have not yet been resolved, whether they must quarantine, they must isolate, or they must not do anything, but we send them home until we can process the information they've sent in. And I believe yesterday, Janet, you all received 660 student sheets that have to be reviewed, processed, and responded to. We'll talk a little bit more about that in a minute. You see the note there about pending test. Employees, today we had 71 isolating. Closest comparable date was February the 7th when we had 72, and the peak date was January the 7th where we had 218. Quarantines, we currently have 69. Closest comparable date was February the 16th with 61, and the peak date was January the 7th with 221. We also have 13 other, again, pending test, information incomplete or not processed prior to nightly data run. We do a data run at like 6 o'clock at night. Now, we'll continue to get those reports after that time, but we do it at 6 o'clock so that schools have the information so they know the number of employees that will be out the next day if we need to make staffing decisions or provisions based on that. Or should a number reach such a level that we can't staff the school with adequate supervision. You can go on our website. I don't have this live to link to it, but you can link to it through the hyperlink. I can't link to it through the device here. That's the new dashboard. Gives more information, and it allows you to customize a specific date range to update the data. This is also data that's included in it, which is the positive cases by school and positive cases by level. Remember, the information I gave you all ago was just a snapshot of one day, and it was yesterday. But it was everybody that was quarantined or isolating yesterday. Our current protocols. Masks are optional per the state proviso. We do 3-foot social distancing where possible. We have enhanced air quality practices, i.e. we're running systems that occupied for longer periods of time to increase fresh air exchange and to accelerate the ionization process we use to help filter air. We've enhanced cleaning and sanitation of high-touch common areas. Still disinfect the entire building after it's vacated at night, but they do cleaning and disinfecting of high-touch areas throughout the day. Minimize indoor large group gatherings during the school day where distancing can't be maintained, and we contact trace when social distancing is not possible. You'll also see we have some funding requests before you tonight. We have requests for the analysis and interpretation of tests and to record and communicate results. That's additional personnel. We are following a procurement process for vendors related to what DHEC will pay for regarding PCR testing. But you see in your board materials a request to extend COVID leave for employees. You see another request in there related to the employment of personnel or contract services in order to speed the response to this. We can't handle 600 form submissions in a day and get the information out in a timely manner. The information about what you have to do long-term. What they get immediately is you're to remain at home until you get further direction. That will cut the time. Being able to read a PCR test for students potentially cuts the time for student quarantine. So you'll see that in your board information later on. Related to quarantine, several members of the Greenville delegation requested that the Attorney General issue a ruling regarding DHEC's authority to impose quarantine requirements. Quite simply, it says, the Attorney General's opinion, issued on August the 16th, the Attorney General's office stated it is office's understanding that the South Carolina Department of Health and Environmental Control issued its July 29, 2021 COVID-19 interim guidance for K-12 operations pursuant to statutory authority contained in Chapter 1, Title 44 of the South Carolina Code of Laws. The General Assembly authorized DHEC in that code to make, adopt, promulgate, and enforce reasonable rules and regulations requiring and providing for the care, segregation, and isolation of persons having or suspected of having any communicable, contagious, or infectious disease. This authority is separate from those derived from the Emergency Health Powers Act, which was exercised during a public health emergency declared by the governor. The shorthand version of all that is simply it supports our adherence and Mr. Webb's previous interpretation to this body of the DHEC quarantine as it relates to that being required. It's pursuant to their statutory authority and it is required. Supreme Court filing on masks. You all know that the Richland School District 2 is requesting an injunction from the South Carolina Supreme Court to block enforcement of the prohibition on mask mandates in public schools. It seeks a ruling from the court whether Proviso 1.108 is constitutional. That's a proviso that says to public school districts, worded differently from the one that affected post-secondary schools, that no state funding may be used to enforce, communicate a mask mandate. And there, in essence, are no employees in this school district that don't have some portion of their pay or benefits paid by state funds, either directly to the benefit provider or indirectly through us to them. So we have read that as a legal requirement. We have, as I'm sure you all have had, I know you have, had people ask you to ignore that mandate, that prohibition against a mandate. Our response on behalf of the administration has been this. We interpret that, as our attorney has interpreted, to be a legal requirement on the school district. At this point, that stands as a legal requirement. Our position, from the administration standpoint, if you are asking us to either impose administratively or recommend to this board that we not follow that legislative action, we do not intend to issue a mandate, nor do we intend to recommend to the board unless, and perhaps, if the court rules that the mandate's illegal. We would not intend to recommend or impose one administratively a mask mandate because we believe it violates the law. And I believe what we would be doing, either by our action or by what we would recommend to you, if we recommended that to you, we would be saying that we choose not to follow this law because we don't perhaps agree with it, and use that to establish a mandate that other people perhaps don't agree with, some of our parents, some of our students don't agree with, but we would expect them to follow our mandate while we're choosing not to follow the law. So we believe that no such directive should come from the administration, nor should the administration recommend any such action to you until and unless the court has determined that in fact this proviso is illegal, or the General Assembly rescinds it. We believe that is the appropriate means by which to seek to overturn a law or regulation, rule, or anything else. You go through the proper process to do so. And at least one school district in this state has already undertaken and engaged in what will cause that process to take place. There is also a Supreme Court filing where the South Carolina Attorney General has sued the city of Columbia, asking the High Court to declare the capital city's mask mandate for schools, as well as any other K-12 mask mandate imposed by a city, county, or school board in violation of the law. So there's another opportunity that will be before the Supreme Court, and I believe, if I understand correctly, they've indicated they will hear arguments on that August the 31st. I don't have that confirmed yet. We also were served with a lawsuit from 3 Greenville County parents filing suit in federal district court against us and SDE, State Department of Education, requesting resolution of conflict between State Proviso 1.108 and CDC implementation order regarding whether masks are to be worn on school buses. And as we have said publicly, we welcome the court interpreting that for us. Because we received this memo, and this is quoted directly from that memo, from the State Department of Education on 7/6/21. Effective immediately, the SCDE will exercise its enforcement discretion granted within this order and will no longer enforce the face covering requirement on state-owned school buses. All of our regular route buses, with the exception of like 3, doesn't include our 12 magnet buses and 3 others, all our regular route buses are owned by the state of South Carolina, by the State Department of Education. They're titled to them. The registration is in the name of the State Department of Education, or the state of South Carolina. And it says, and with the use of face coverings by students and staff on buses and within school facilities remains a recommendation of state and federal public health officials, and Proviso 1.108 does not prevent districts from encouraging the wearing of face coverings in these settings. Now that's a paragraph devoted solely to buses. The first paragraph of this memo, which is not in here, relates solely to putting a mandate in place in a school facility. The third paragraph, which specifies neither that it relates to the first or the second. So you read it as a standalone third paragraph. However, districts may not create or enforce any policy which would require the wearing of face coverings. Should a district decide to act contrary to this law, state funding may be withheld. Doesn't say specifically related to school facilities, doesn't say specifically related to buses. It says in a separate paragraph indicating a new subject, however, districts may not create or enforce any policy. So again, we welcome the clarity from the court. Is this right? Is what the CDC directed? Is that the legal parameter we operate in? What's the law there? Today, the ACLU filed a lawsuit in federal district court on behalf of 9 parents and their children and 2 disability rights organizations against Governor McMaster, Attorney General Wilson, State Superintendent Spearman, the Greenville County School Board, and 6 other South Carolina school boards. The suit argues that the state's ban on mask mandates effectively excludes students with disabilities or underlying health conditions from public schools in violation of the Americans with Disabilities Act and Section 504 of the Rehabilitation Act. Now, beyond that, we don't really have anything further to say publicly about that because we were just served with that a few hours ago, literally. But again, presenting an opportunity for a court to determine these conflicting laws. One thing that has been consistent throughout this whole issue of COVID is inconsistency. If there is one consistent thing, it's inconsistency. So we welcome a court to look at what are the requirements and say, these are the requirements. These are the ones you must follow. These are the ones you don't have to follow. They're recommendations. And which authority exceeds the other authority. And hopefully that decision will be rendered sooner rather than later. I'd be glad to answer any questions you might have that are within my ability to answer.
Thank you, Dr. Royster. I'm going to start down on the left here with Mr. Sailors, and I would ask all participants to try to keep their questions for 3 minutes, so we can get everybody by 6 o'clock. We're going to have a executive session at 6 o'clock, so if you have some legal questions, then save them to 6 o'clock. We're going to executive session. Mr. Sailors.
Thank you, Mr. Chairman. Dr. Royster addressed one of my questions in the statement about the disregarding of state law versus other districts performing a mask mandate, so I'll skip that. I would imagine most of us have received emails or questions from members of the community related to a comment that was made in Washington by the administration saying in simple terms, if a school district loses its money from the state withholding those funds because they choose to enforce a mask mandate, that the federal government will in fact provide those lost funds. Now, I understand we could not use ESSER to replace lost state funds if we were to go in that direction. But the legitimacy or the legality of what the Biden administration put on the table, can you speak to that? Because we need to know how to respond to that.
But I think the first thing would be, this is a question separate and apart from disregarding what we believe has the effect of law.
Correct.
If you were to choose to disregard that, I have seen no change in the federal regulations for ESSER expenditures that allow for the replacement of lost revenue. All the direction we have received to this point from every phase, so CARES 1, CARES 2, and ESSER, has clearly stated you may not use this to replace lost revenue. Clearly prohibited. Now, could there be a change in that direction? I guess there could be. We've not yet seen any change in writing from the direction we have received.
Okay.
You may recall, we've tried a couple of times to get them to replace lost revenue. They said, no, we can't do that because it's replacing lost revenue. Okay. But we had to find other means by which to do it.
It's my understanding that the Department of Health and Environmental Control has shared with the school districts in the state new guidelines, roughly 60 pages. Can you give us any idea what those changes are, or are you still going through it?
We're still going through it. From what we have read to this point, depending on how it's promulgated, whether it's put out as a change in requirement or simply a change in recommendation, if it's put out as a requirement, it could have a significant change to what we consider close contact. So we've asked a number of questions about that. We've raised some concerns about it. My understanding is they're holding on that until they can clarify some of that with us.
And that's the difference between 3 and 6 feet?
Based on my current reading of it, would be the difference between 3 and 6 feet. Okay. Yes, sir. And
then the last thing, and you touched on this briefly, the Supreme Court indicated originally that they were going to issue an order or a ruling or commentary related to the Richland 2 request. And it was supposed to be yesterday.
There were some news reports or a news report over the weekend that indicated the Supreme Court would rule on the injunction portion. So
Right.
you've got the injunction that the school district asked for, hey, put a hold on this proviso until you can hear our arguments and rule on it. My understanding was they were inclined to issue a ruling on the injunction request yesterday, but that didn't occur.
So the short of it is, we have no idea what their timeline is.
I
to rule on
believe they
this.
have indicated they would perhaps address it within a week. Mr. Webb, was that?
I believe so. It's not certain, though. There has been a time and date set for the City of Columbia, the
Which is
Attorney General.
August the
31st,
31st, if I
That's
remember
correct.
correctly.
Okay.
Yes, sir.
Thank you, Mr. Chairman.
Thank you. Ms. Mosley?
Mr. Saylor asked my questions, so I'm good.
Thank
Okay.
you. Mr. Lewis?
Most of my questions are legal natures, and I think I understood you say you prefer us to wait till executive session to get legal advice. So the one question I have is just about that statement about PCR tests resulting in shortened quarantine times.
Yes.
So could you just clarify that?
I'm gonna defer to Janet so she can give you the precise numbers, dates, the amount you can shorten. Ms. Logan?
Sure. So the question was, you want more information on the 7-day quarantine option?
So I just wanted to clarify, so by having a PCR test, it can reduce the number of days that somebody needs to quarantine from what to what?
So currently, the CDC maintains 14 days is the optimal quarantine period. We have adopted the 10-day quarantine for students and the 7-day quarantine for staff. For 7-day quarantine, you have a PCR test between days 5 and 7, and if negative, you can return on day 8.
So would these PCR tests be available now for students, or we're just clarifying that we're using it for staff?
We're using it for staff, and we are looking at opportunities to use it for students.
Which is one of the reasons to request the additional funding for us to either hire some people or contract with a third party. So they can go through the PCR test results and properly analyze them, which is what we're doing internally with employees. And the employee one is about to overwhelm our ability to do it, just because of everybody we have doing these things, with the exception of some nurses we're paying for, maybe some, I think in one case, a retired nurse. Basically, this falling on other people that already have a full-time job to do. So we've reached the limit we can do without engaging other staff.
Thank you. Ms. Goodwin Caldwell?
Dr. Royster, do we have a plan, or are y'all in the middle of creating a plan for if this Delta variant gets out of control and we have whole schools or whole classes, whole schools catching COVID? Do we have a plan here in the district for that?
Yes, in fact, I won't try to go through the numbers. I believe we sent you the other day the guidance numbers we use for closing a classroom. And I believe we've closed one today, one, because it hit that number. And that's the way we would go about doing it. We would look at individual classes. Then if we get numbers that exceed our guidance, and I think we showed to you, we have some flexibility in that based on the size of the space the students are in, the number of students in it, a percentage of that class instead of just a flat 3. Because 3 in a class of 10 is obviously a much higher percentage than 3 in a PE class of 40. So we would look to close down an individual class. If we had to shut down a whole school, we would shut down a school or parts thereof, maybe a grade level. It depends on how the virus presents itself, where that spread may seem to be. But we'd shut down perhaps individual class, perhaps more than one class, particularly when you get to middle or high school level, or a grade level, or ultimately perhaps an entire school. I think what might most cause an entire school to be closed would be if we can't provide enough adults to adequately and safely supervise the students. One of the things that you'll also see in the request to redirect some ESSER money is to hire some more permanent substitutes. That is a person to be there every day. That's one less the principal has to go look for when they're looking for substitutes. So right now, it's all on an individual basis. Yes, we have that plan in place, and we make those decisions as the information comes forward, and we act on it as soon as we're aware of it.
Okay, and does with this Delta variant, does that 15-minute rule still apply with the Delta variant?
Right
It
now,
applied last year.
Right now, the guidance is 15 minutes over a 24-hour period, depending on adult or student, between 3 feet or 6 feet. So yes, that has not changed at this point.
Okay, that's all I have.
Thank you, Ms. Mosley. You have one question real quick.
Yeah, I'm so sorry. I just wanted to clarify something. I think I heard at the return to school, back in August, the return to school meeting about the quarantine. Are we tracking, I thought I heard Dr. McCrary say that we are now tracking, or we now have the ability to track those who are quarantined, because obviously right now it still holds true that we seem to be quarantining more than we actually have isolating. So
Yes.
are we tracking
It is my understanding.
the
Dr. McCrary
quarantine
is
that can
tracking
move,
yes.
that, let's say they're in quarantine and then they develop symptoms, so then we move them over to what I call the isolation category?
Yes.
Are we now, that's not something we tracked last year?
He has some tracking from the very end of the year.
Okay,
But yes, we're doing that.
okay.
Now, some of the data you saw last year, you didn't see tonight, because part of it's like a 2-week look back.
Okay,
You know, where we compared how we are versus the community.
right.
Well, obviously, we don't have a 2-week, we got 1 week, so we don't have a 2-week period to look back. Now, if you captured just today's number, just today's, with what we understand is today's community number, student and faculty, we're at about half the community rate right now. That's just one day though.
Right.
That's looking at their kind of 2-week look back in our 1 day.
Okay.
So not a great comparison, but it gives you a little bit of information.
Right. So my second and last question, kind of to piggyback on what Ms. Goodwin-Call asked. I don't have the benefit of history, so historically speaking, I'm actually aware that, like, I have a friend in another state whose school system had to shut down once, not because of COVID, this was because they had too few staff, too many out with the flu. Have we ever historically, in your tenure, had to shut down a school or even shut down for any reason?
Health,
Or
I said you're not
like,
only
yes,
health related.
yes, health related, like if it's a really bad flu season, or the norovirus, I know is something that has shut down a school before.
I do not recall us ever reaching that point, but we have in my, now 17 total, we've come real close, probably a couple of times on the flu. We'd have a high percent of students
Right.
absent, but kind of the tipping point there was a very high percentage of teachers absent, but we were ultimately able to cover it. And I would imagine, but can't immediately recall, we may have had a meningitis situation where we had to shut a school down. Do you remember one, Janet?
I don't remember when.
We had one in the district I was in before coming to Greenville, which that happens, again, it's a rare occurrence, but that does happen on occasion. A few years ago, there were a number of schools shut down in a district in the upstate related to TB. Some of you may remember that.
Thank you.
Thank you. Dr. Stiles.
I didn't have a question, but I did have a couple of comments. First, I wanted to say to you, Dr. Royster, that I'm very appreciative that you're looking at hiring additional staff to support our current staff members who are managing all this data. I think that shows support for them, and I really appreciate that, and I feel like that we really need that position. So thank you. And also, I'd like to say that our approach for dealing with the COVID outbreak that we're experiencing is, I think it sets the bar for our state. And I think that it's more proactive versus reactive. And I feel that's always the best approach. And I'm just impressed at how we're managing the data and how we're reacting. Again, we're proactive versus reactive, and I just want to thank you for that. I know that's taken a lot of work and a lot of effort, and I want you to know that I appreciate it, and I believe my community really appreciates that. Thank you.
Thank you, Dr. Stiles. We very much appreciate your kind words. Ms. Bush.
Yes, I want to follow up with a question on those PCR tests and our ability to, especially that it is very important that if we can shorten that for a student, even for an employee, but shorten it for a student from 14 days to 5 to 7 days, because having just gone through that whole process of being exposed and then having to wait till that 5th day, and then I learned from experience after making about 9 different phone calls to different places that there was a shortage currently, and that they were only doing the PCR, the rapid test, if you were symptomatic. So apparently with the surge of COVID that has hit, the first couple of places I heard it, and I said, well, no, I'll call. And so I kept being told that I could go and get the test, but it would be 3 days before the test come back, which led into, and I wonder I know we've talked about this before, but our recommendation of where someone can go, if we can look at our community partners and make that information just overwhelming to parents, because until you actually find yourself in this position of, oh my goodness, I've had an exposure, now what do I do? And everybody clamoring, if we can make sure that there are, because people kept saying, oh, well, call this place, that you can go right in and they'll give you the test results within 20 minutes. And I found that, like I said, to be not true on that particular day. And I'm sure things change and maybe they're getting supplies in and they're able, but anything that we can do to have that information ready for our parents and employees, so that if there has been exposure, that we can shorten that quarantine time. And also, with that, I don't know if there would be, other than just recommending, I know it was just as quick as a nose swab, that if it became to where we had a school where there was a huge outbreak, that we even look at the possibility that there could be some kind of on-site. Is that, I know you said you were planning for, if we have, a huge outbreak within a community, within a school, that we could partner with and have something set up so that that it would just make that pathway to get back to school and to get those that do not become symptomatic and do test negative back to the classroom.
Well, one of the things that we believe is a possibility, of course, we've talked about this before, about we don't really want to do testing in a school, because we want you to stay at home. If you feel like you need to go get a test, we want you to stay at home and go get your test. We do, I think, have an option, I don't know how much it's fleshed out yet, to go through DHEC, get a third-party tester that they will pay for, and we can set them up somewhere locally. It doesn't necessarily have to be at a school, that we could then refer people directly to them.
Right.
We wouldn't be given the test. It wouldn't be given, it might be given on our property, but maybe we do it in the parking lot at MT Anderson, or we do it somewhere else, because there are places we can find to do it, as opposed to bringing them in a school, which might alleviate the concern you're talking about. Maybe there's not going to be a sufficient number of tests. I think we have run into a few problems with employees with getting it back in a timely manner, but most of them we've gotten back on the shortened time frame. And to make sure we're all kind of on the same page with that, because this gets a bit confusing. There's all these different numbers. If you do this, it's this. If you do this, it's this. You have to take the test between the 5th and the 7th day. And if you get a negative result back, you can come back as soon as the 8th day. But it does cut the period, and if it cuts a day off, I think worth doing. And to me, it would also be worth doing to reassure the person that you don't have COVID, that you test negative. It, to me, would be certainly a form of reassurance if it were me going to do that.
Thank you.
Ms. LaVentus Wells.
Yes. Dr. Royster, first of all, having over 25,000 bus riders and being down 62 bus drivers and being 97% on time to schools compared to 83%, I think that speaks volumes of homework done and leadership there in making sure those routes have been tested, ridden, shortened, and tweaked to the benefit of our students. So I commend you on that. I'd like to ask a question on the numbers. The isolation numbers are 71, the quarantine are 69, and other are 13. Are the isolation and quarantine duplicated numbers? Are
No.
any of those duplicated? They're not?
No, they're not.
Okay.
If I might, too, to your first comment, thank you, but I don't know if he's in here or not, but I'm sure he's probably listening. If he's not, we'll pass it along to him. You know, Mr. James and the people in transportation do an outstanding job. The supervisors, the center managers, the drivers. It takes an incredible effort for them to do what they do on a daily basis. And what you saw in those numbers reflects the effort they put forth there. So thank you for saying that. But those are unduplicated numbers. And that other, they're simply ones we've sent them home till we can get all their information and get them the correct answer.
So as soon as we have isolated situations, we immediately, they're tested, we know they've got it, is that correct? And we're moving forward in making sure those surrounded know and get, go into quarantine and get the assistance that they need, correct? Mm-hmm. Are we able to use the ESSER funds to pay for temporary or contract personnel that can read and interpret these tests so that we don't have as much burden on school personnel in the schools where they can do what they do best, teaching and so forth? Can we use ESSER funds for that?
Yes, and that's in a recommendation that you'll take up in your board meeting in, an hour and 8 minutes.
Okay, so with that being said, would these be temporary slots just because ESSER, we don't know how long we will have that funding available?
They would either be temporary positions or use a third-party contractor,
Okay,
neither of which would have an ongoing obligation.
all right. And then, I appreciate everything. I appreciate the information, and I'm glad we're having this discussion. And I did have one question. I was trying to stall because I couldn't remember what it was, but I do. Have we maxed out for the choice of parents who have decided they didn't want virtual, but now they do? Do we have that choice? I know it's 3,012 students or something like that. Is that the max that we maxed out, or can we extend that number, to meet the needs of those parents who want to go to virtual program?
What we've said about that is, unlike this thing about mask, there's not a mandate about you can't put more students in virtual.
Right.
What there is there's a financial penalty if you do. So what we have said, if we were to exceed the 5%, we would come to you and say, we want to use ESSER funds not to replace lost state revenue, which you can't do, but to fund teaching positions in the virtual program, which is allowable under ESSER. Right now, we're not at 5%. We're just under 4%, that 3,012. We gave them a deadline, but we really allowed people to ask to come into virtual all the way through, Jeff, Monday? Yes, sir. Yesterday, Monday.
Okay, good. I just want to make sure, because we talk about choice, and everyone has a choice, And I just want to make sure we've made that available. If they choose to do virtual, then I'd like for them to have that choice. If they choose to wear a mask, not wear a mask, whatever the situation, our hands are tied, it is what it is. I just want to make sure that availability is there. That's it, thank you so much.
Mr. Doolin.
Thank you. I have a question about the Attorney General's opinion on the second page that's listed as that. Since we're going to be tracking the quarantine data from what students are quarantined and how many remain healthy during that period versus how many get sick over that week or two, will having that data change anything that, I really am frustrated that DHEC doesn't have that data already, for starters. But if they are enforcing reasonable rules for people that are sick or suspected of being sick, but our data shows that children who are quarantined, whatever percentage it is going to show, is there a chance that that could change what DHEC recommends? Or what are we going to do with that data once we have it and we know how many people that quarantine actually get sick?
It's our intent to share that information with DHEC. There are other superintendents in the state that have the same intent that also are tracking quarantine converted to isolation. Then it would be up to DHEC to take that information into consideration and determine if they want to change their exclusion requirement, which has totally within their discretion to do so in our reading of the statute, which was reinforced by the Attorney General's opinion.
So we won't have the ability to make any changes based on that data?
We wouldn't have the ability, because to do so at this point would violate their exclusion list, which their exclusion list includes exposure to an infectious disease. It defines what that exposure is and compels us to exclude those people.
Ms. Morrison Fair.
I had two questions. Thank you. My first question, I wanted to be clear, at least in my mind, that teachers who are affected by the quarantine or isolation will be compensated. And is that through 20, 21, 22?
Pending your action in an hour and now 3 minutes, they're good till August the 31st. If you act in the affirmative to our recommendation, it would extend that through August of next year. You may recall last year we recommended to you and you extended a COVID leave from the beginning of second semester till the end of August, not the end of the school year, but to the end of August. So right now they're covered. Our first step with them is if they can do their work from home, we want them to work. They're not charged anything for that. If they can't work, then they would first exercise the COVID leave. Then it would go to their sick leave. It has to be more than the 80 hours that we have in there.
And my second question is, your numbers that you gave for students isolated, what age groups do that is the majority, or the majority of students in?
I don't have that in here tonight, but I will be glad to send it to you all either later this evening or in the morning.
Okay. And lastly, I too would like to thank you and Greenville County. The whole machine is such an unbelievable task for this school district to keep this ship afloat. I know we're having this conversation and it might seem like an easy conversation, but I know the bells and whistles and all the I's that have to be dotted and T's crossed. It's just unbelievable. So I thank you for your effort and your staff and everybody that's on board with making sure that this is successful for this school year.
Thank you, Ms. Morrison Fair.
Thank you. Without objection, I'm going to extend this session so we'll have time for Ms. Wales and Mr. Seth. Ms. Wales.
Thank you, Mr. Chairman. Dr. Royster, you gave your some interpretation of what that budget proviso applied to or how you applied it. And some of the emails that we've gotten, there are some folks that have read that and said that we are applying it, allowing it to apply too broadly, and that it could be applied more narrowly. But I think what I heard you say was that you felt that it meant that that everyone in every cost in our district is tied in some way to state funds, and because of that, you felt like it was clearly off the table and a total prohibition.
We can't isolate a group of employees. I mean, we might find 5 or 6, but I don't think we can even find 5 or 6. And they'd have to be part-time that weren't getting any benefits. Because every employee is somehow touched by state dollars, whether it be salary or fringe benefits. It also goes on in that proviso. Doug, you have it in front of you.
I do.
Would you read that? Because I believe it goes on to address mask in general, not just the financial aspect of it.
Well, and what I have, Dr. Royster, is no school district or any of its schools may use any funds appropriated or authorized pursuant to this act to require that its students and or employees wear a face mask at any of its education facilities. This prohibition extends to the announcement or enforcement of such a policy.
Which kind of puts a second spin on it to me, and I'll let Mr. Webb elaborate on that in executive session. But to me, it says very clearly, you can't do this. We don't intend for you to do it. Now, I don't agree with that. I think that's a local decision that ought to be made at the local level. But our General Assembly acted to include that in the budget as a proviso. And I think now the argument that's right for the court to hear is in fact that a legally imposed prohibition related to whether or not you can put unrelated items in a budget bill.
Well, and it's a poor way to govern, to use your budgeting process every year to try to impose, legal requirements. And I've said my piece about being handcuffed by them and not being able to make decisions locally, and I'll continue to voice that. But specifically, I guess, when I read that, what occurred to me is this budget proviso provides what percentage, this is the base student cost, the budget that provides the base student cost numbers we get, right? So
it is literally every dime of state funding that we receive. The base student cost, DIA teacher salary funding, all special state revenues, the amount the state subsidize, which we never see. There's a part of the insurance that we don't ever see that they're subsidizing. So it includes all those things.
okay, but there's a percentage, which is generally about 30% of the funding that provides the education for the students in Greenville County, that is provided by local property tax. Those are local funds, local revenue. So
yes.
I guess while I understand that you're saying, well, a state dollar touches everything we do, on the other hand, I might make the case that we have 30% of our budget locally generated revenue that we choose every year to spend however we decide to spend it. So in that way, I do, if this board wanted to have a conversation about whether or not we should be requiring masks, it seems to me there is a funding vehicle that could be used to make that determination and to debate that and decide it and then make that happen. So I guess I'm kind of looking at the attorney, because I'd like to kind of understand, is there a flaw in my logic there, or is that plausible?
Well, Ms. Wells, my interpretation of the proviso mirrors Dr. Royster's in the sense that the state funds that we receive are so commingled with federal funds and local funds that we could not parse those away from our expenditures, and therefore we would jeopardize and risk losing state funds if we were to implement.
Well, and I'm sorry, my screen just, it says you can't use the funds, no district may use any funds appropriated through this act to require that its students wear a face mask. So that, I guess I'm still not seeing that really means that, what that says to me is you can't use your funds that we're giving you to ask your staff to enforce masks, or to buy masks, or to communicate it on your website. So not to say that if you do it at all, then you jeopardize all your funds, so.
And I agree with you, Ms. Wells, there's not a penalty section in this proviso. You know, there are certain statutes and certain laws, both federal and state, that will have penalty provisions attached to them, and this does not. And that's one of the arguments being made by Richland 2 School District to claim that this is improper and improper proviso, and that it's unconstitutional because it's not tied to a budgetary item, or there's not a financial penalty associated with it. But I believe it's the most logical interpretation is that the mechanism penalty would be loss of funding, given that it's part of the proviso.
You know, last year we consistently followed, and time after time, when I spoke to my constituents, I hung my hat on, I'm not a medical professional, and it's DHEC and CDC that we're looking to provide guidance. And we may not like their guidance, and we may think that they need to do something different, and I'm fine with putting pressure on them to say that, but last year we consistently followed that guidance, even while the governor was standing up and saying whatever he wanted to say on any given day. And I get that this time it's got this regulatory nuance, but it's a really slippery slope for them at the state level to create things that are in conflict with their own state departments and continue to give us local requirements and handcuff us, I'm going to use the word again, handcuff us in our local governance, instead of dealing with their own, figure it out at the state level and get it consistent and then let us do our job. But the frustration from parents on all sides of it, that we're afraid you're going to do a mask mandate, we're afraid you're not going to do a mask mandate. It's maddening because, again, this body was elected by this county of people to help decide how we need to send our kids to school, and we're not able to do that. So, you know, I maybe in executive session we can get a little more, I'd like a little more clarity on the legal ramifications of where we are and what next steps we take. Thank you. Sorry.
Thank you, Ms. Wells. Mr. Suddeth, you get to end this session.
Mr. Chairman, I do not have a question, but I have a comment, if you would allow it.
Yes, sir.
I have spoken and communicated with the constituents in my district, and I have told them I would vote as they thought I should vote. But I've also let them know that I am one person of a board, and I myself cannot do anything. That it will take 7 board members to vote yes on whatever we bring forth. So I have told them when it comes before the board as to what action we might take, then I would vote the way my district feels. But until that comes before the board, I can't go and tell them this is what we're going to do. So I would hope that at some point in time that the board, instead of individuals on the board, will make decisions about what direction we want to take, and of course with a great deal of help from our superintendent. So hopefully that will come soon so we can quit doing all of this, well, maybe and what if. Because I keep telling them that I can't do what they want me to do by myself. And it's going to take 7 board members to do that. So I hope in the very near future that we will be able to come up with a plan of action that we wish to take as a school board to help with the conflict that we're in, which includes mask and not mask, or which includes vaccination, not vaccination, and which includes other things like social distancing, whatever. Then when we get that, presented to us, then we can go ahead and vote and determine and let the community know that this is what we're going to do as far as our situation is concerned. And it is a situation that I don't have answers to, but with the school board can come up with an action plan that we want to take to combat the COVID-19 virus. Thank you.
Thank you, Mr. Suddeth. Thank everyone. We are going to end this workshop, and it is adjourned. And now we're going to go into the regular board meeting and executive session. Ms. Bush, do you have a motion?
Yes, I move that we go into executive session to discuss personnel matters and homeschool applications and to receive advice on legal matters, including the proposed career multi-social work and litigation pertaining to COVID-19 protocols.
Thank you, Ms. Bush. What did you say?
That goes on, it's a separate recording.
Okay, so you need to stop.
Yeah, we need to do that separately.
Okay.